Introducing the 462 Horizon Series stretchers with Retractro rails. The 462 EM-CST and 462 GM-CST have a patient surface of 25 inches, and the 462 FM-CST and 462 HM-CST have a patient surface of 30 inches for bariatric patients. The 462 EM-CST stretchers have a 500-pound weight capacity, and the 462 FM-CST and 462 HM-CST have an impressive 800-pound weight capacity. Our stretchers are used for multiple procedures: patient treatment, transport, and recovery. 8-inch Tente casters and central brake and steering come standard on every unit. This system makes steering and braking easy and safe for staff and patients. Red pedals are for braking, and green pedals are for steering. Pedals are conveniently located on all 4 wheels. The caster braking system should always be locked when patient is not in transport. When patient is left unattended, the caster braking system should always be locked, and patient side rails placed in upright, locked position. To engage steering mode, fully depress the green pedal. When the pedal is fully depressed, the 5th wheel deploys, allowing for easy mutability and steering for attendant. To release the 5th wheel or steering lock, depress down on any of the 4 red pedals until it is parallel to the floor. All 4 casters will rotate and swivel freely. To adjust height of stretcher, press pump pedal to the floor until desired height is achieved. To lower patient surface top, press down on the 2 release pedals at the same time until the litter is at desired height. For enhanced patient comfort and safety, all the 462 Horizon Series stretchers with Retractro rails have 16 degrees Trendelenburg and 16 degrees reverse Trendelenburg. Achieve Trendelenburg by pressing down on the release pedal closest to the head end until you have reached the desired position. Achieve reverse Trendelenburg by pressing down on the release pedal closest to the foot end until you have reached the desired position. To activate the Fowler position, grab the Fowler frame tube and the red release lever, then lift up the Fowler until desired height is reached. Lower slightly until ratchet is engaged. Make sure the Fowler position is locked by pushing down slightly on the Fowler. To stow the Fowler position, pull the red release handle toward the outer edge or the back section to release and stow. To raise knee flex, flip crank upward and rotate clockwise until desired position is reached. Then return crank handle to original position. To lower knee flex, flip crank upward and rotate counterclockwise until desired position is reached. Then return crank handle to original position. The standard IV pole is located on the right center of the cross frame at the head end of the stretcher. The 462 Horizon Series stretchers with Retractro rails have rails that go into 3 positions: full, half, and lower. The 462 Horizon Series stretchers with Retractro rail feature an easy-to-clean thermoformed base cover with O2 tank holder and ample storage space. Our stainless steel Retractro side rails with rail caps offer a new and updated look. Contact your Hausted representative to see how the Horizon Series stretchers with Retractro rails can streamline your caseload and transform your OR.